Bismillah ar-Rahman ar-Rahim. Our lecture today about medical disease during pregnancy. Pulmonary disorders. The most common is asthma, which affects up to 4% of women. It is a chronic disease that inflames and narrows airways due to increased responsiveness of tracheobronchial tree to multiple stimuli. Patients present with cough, shortness of breath, and wheezing. Asthma is common in young women and therefore is seen frequently during pregnancy. It has no effect on pregnancy. Only poorly controlled asthma may be associated with low birth weight and preterm labor. The effect of pregnancy on asthma: 1/3 show no change, 1/3 improve, and 1/3 deteriorate. Management of asthma. Multidisciplinary team need treatment should be continued during pregnancy. Measure expiratory flow rate. Follow-up of blood sugar because of increased risk of gestational diabetes mellitus in women on long-term oral steroid. Asthma attack may occur during labor. If women on long-term oral steroid, give her IV hydrocortisone during labor because of risk of collapse. Avoid prostaglandin F2 alpha. Encourage breastfeeding because it decreases risk of allergy later in life. Pneumonia. Pneumonia, it is an inflammatory condition of the lung affecting primarily the alveoli. It can be caused by bacteria, viruses, fungi, or due to autoimmune disease. Its incidence is about 1/1 in 1,000. Clinical features include cough, shortness of breath, fever, and fatigue. Diagnosis usually based on clinical findings. Chest X-ray may be needed. Treatment include physiotherapy, adequate oxygenation, hydration, and appropriate antibiotics like ampicillin, cephalosporin, or erythromycin. Complications include preterm labor and low birth weight. Now, let us move to heart disease and pregnancy. Cardiac disease. Heart disease in pregnancy could be congenital heart disease, rheumatic heart disease. The pattern of cardiac disease in pregnancy has changed over the past few decades. Congenital heart disease is now more common than rheumatic heart disease. Its incidence is about 1%. Clinically, there may be dyspnea, chest pain, palpitation, tiredness, cyanosis, and peripheral edema. Antenatal management. First, it is need multidisciplinary team. A preconceptional optimization of maternal condition and modification of free drugs. Counseling regarding the risk of pregnancy. Correct any maternal complications, hypertension, arrhythmia, anemia. Monitor signs of heart failure clinically and with echo. Monitor fetal growth because of risk of intrauterine growth retardation. Intrapartum and postpartum management. Aim for vaginal delivery with shortening of second stage of labor. يعني من تجي البيشنت وهي عندها هارت ديزيز وطالب انه هي تسوي سيزاريان سكشن، ماكو انديكيشن فور سيزاريان سكشن بالهارت ديزيز، لكن بالعكس احنا نشجع على النورمال vaginal delivery with shortening of the second stage of labor. Maternal monitoring. Avoid aortocaval compression. Epidural anesthesia can be used. Careful watching of IV fluid in labor. لازم احنا ما نخلي المريضة تاخذ fluid overdose during labor. Oxygen in semi-sitting position. Decide if prophylaxis against endocarditis is needed. Minimize blood loss. Avoid ergometry. لازم طبعا contraindicated lethargy بالheart disease وبالأسمة. Observe for signs of pulmonary edema. Discuss contraception before discharge. يعني المريضة لازم اللي هي heart disease وبعد الليبر لازم واحد يسوي لها discussion عن contraception حتى يعني يفهمها شلون نسوي spacing بالبريجنسي وشنو خطورة البريجنسي على حياتها، وممكن هي can tolerate or not. kidney disease in pregnancy, renal disease, urinary tract infection اللي هو common. It is more common in pregnant than non-pregnant women. Most commonly due to E. coli. It includes asymptomatic bacteriuria. Incidence is about 5 to 10%. If not treated, it will lead to symptomatic infection in about 40% of cases. A treatment should be continued for 3 days. Cystitis incidence is about 1%. Pyelonephritis incidence is about 1%. Cystitis, it is infection of lower urinary tract. Its clinical features include frequency, urgency, dysuria, and suprapubic pain. Send for the patients for urine sample for culture and sensitivity. A treatment with oral amoxicillin or cephalosporin for 1 week. Increase oral intake and analgesia. Chronic renal disease management need multidisciplinary team care, checking of medication used before pregnancy, baseline investigation, especially blood urea, creatinine, and protein in urine, observation of blood pressure, investigation like blood urea and creatinine, check for anemia, preeclampsia, monitor fetal growth, and aim for vaginal delivery also. In pyelonephritis, its incidence is about 1%. It is infection of upper urinary tract. The patient complains from systemic symptoms like fever, rigor, nausea, vomiting, and low pain. The investigation includes general urine examination, urine for culture and sensitivity, full blood count, urea and creatinine, if pyrexial patient, and ultrasound. A treatment with IV antibiotics, IV fluid, and injectable analgesia. بس نيجي على thyroid disease أو thyroid disorders اللي هي very important to know. Thyrotoxicosis, its incidence is 1 in 500 pregnancy. The most common cause is Graves' disease اللي هو autoimmune. There will be high free T3 and high free T4 and low TSH. It improves in the second or third trimester and deteriorate in the puerperium. Presentation include weight loss, increased appetite, anxiety, palpitation, heat intolerance, muscle weakness. Maternal and fetal outcome is usually well in controlled disease. If not, there will be increased risk of infertility, miscarriage, IUGR, and preterm labor. How does hyperthyroidism affect the mother and the baby? طبعا راح affect on fetal growth، منطينا low birth weight baby، تسبب لنا high blood pressure during pregnancy، ممكن تؤدي لنا heart disease، ممكن تسبب لنا preterm أو premature birth. thyroid storm اللي هي جدا مهمة، a sudden severe worsening of symptoms اللي هي راح تكون during stress condition اللي هي الليبر والسيزاريان سكشن، راح يصير عندنا thyroid storm اللي نسميها ثورة الثايرويد. management need multidisciplinary team, aim for optimal control before conception, check for TSH receptors, stimulating antibodies, monitor total free thyroxine at first monthly if stable every 3 months. يعني thyroid function test، نشوف monitoring of thyroid function test at first monthly، بالبداية نشوفه monthly if stable every 3 months. serial ultrasound for fetal growth، يعني مهم طبعا بنسوي monitoring للthyroid function test لازم نسوي free T4 ونسوي TSH وياه حتى نشوف ال efficacy of our treatment. serial ultrasound for fetal growth. Use lowest dose of anti-thyroid drug to control the disease during pregnancy. because both carbimazole and propylthiouracil cross the placenta. Aim for vaginal delivery also. Breastfeeding is safe if low-dose drugs are used. Monitor for transient neonatal hyperthyroidism. Hypothyroidism incidence is 1%, characterized by low free T4 and high TSH. Clinical presentation includes weight loss, decreased appetite, cold intolerance, dry skin, lethargy, and fatigue. It has no effect on pregnancy in well-controlled disease. If poorly controlled, it may lead to infertility, miscarriage, IUGR, IUD, preeclampsia, and preterm labor. بس راح نشوف شلون effect of hypothyroidism. Affect the mother and the baby. Affect overall growth and development of the baby. Increase miscarriage rate, low birth weight, anemia, high blood pressure in pregnancy. Management need multidisciplinary team. Aim for optimal control before conception. Check for TSH receptor blocking antibodies. Monitor thyroid function test at first monthly if stable every 3 months. Serial ultrasound for fetal growth. Use lowest possible dose of thyroxine to control the disease. طبعا الديماند for thyroxine بالهايبوثايروديزم يصعد، يعني الدوز تصعد بالهايبوثايروديزم الثايروكسين during pregnancy. To control the disease, aim for vaginal delivery. Breastfeeding is safe. Neonatal hypothyroidism is very rare. يعني احنا نبدي دوز قليلة وبعدين نصعدها according to the investigation. Pituitary disease اللي هي prolactinoma are the commonest pituitary tumor seen in pregnancy. It has 2 types، يا اما microprolactinoma او macro. المايكروبرولكتينوما اللي هي السايز اقل من 1 سنتيم، والماكروبرولكتينوما السايز اللي هي اكثر من 1 سنتيم. البرولكتينوما increase in size in pregnancy and cause symptoms headache, vomiting, blurred vision, especially in the 3rd trimester. Usually it will cause infertility, but it has no effect on pregnancy. شوفوا هذه البيكتشر اللي هي البرولكتينوما. هنا نشوف البيتوتري التيومر وين يصير بالسلة فارسيكل. المانجمنت need multidisciplinary team. MRI is the diagnostic tool. Prolactin can be used in diagnosis of prolactinoma in pregnancy. لا prolactin increase during pregnancy. Patient education about any symptoms that suggest tumor expansion like headache, blurred vision. Visual field testing. Dopamine receptor blocker shouldn't be used in pregnancy except if there is a tumor expansion. Surgery used in case of failure of medical treatment. Aim for vaginal delivery. Breastfeeding is safe. بس هذا السؤال لكم لازم تطلعوه. هل إنه البرولكتين level can't be used in diagnosis of prolactinoma in pregnancy and why؟ نقدر نستعمله كدايجنوستيك، وليش إذا نستعمله ليش وإذا ما نستعمله هم ليش؟ لازم تفكرون بيه. الادرينال ديزيز اللي هي تشمل اديسون ديزيز. It's condition of adrenocortical failure with deficiency of glucocorticoid and mineralocorticoid. Most common cause is autoimmune destruction of adrenal gland. The clinical features include weight loss, fatigue, nausea, vomiting, hyperpigmentation, low blood pressure, and hypoglycemia. No adverse effect in well-controlled disease. Management include multidisciplinary team. Patient should continue unusual steroid dose during pregnancy. Increase dose of steroid is in stressful conditions like infection, hyperemesis, labor, or surgery. Aim for vaginal delivery also. Breastfeeding is safe. Cushing syndrome. It is a metabolic condition characterized by glucocorticoid excess, most commonly due to excessive pituitary ACTH secretion and adrenal adenoma. Diagnosis depends on clinical findings: weight gain, moon phase, striae, skin bruises, and laboratory results. Management also need multidisciplinary team. Medical management with anti-steroidogenic agents such as metropone has been shown to be effective, but surgery is the treatment of choice for pituitary or adrenal tumors. Management of maternal complications include diabetes mellitus and preeclampsia, education regarding increased risk of fetal death, prematurity, and also of vaginal delivery. Breastfeeding is encouraged. Thank you very much.